Okay. Good day. I'm going to perform a range of motion exercises. Definition: an exercise that helps to use muscle groups that keep many joints in an effective range of motion. When all or some of the normal activities are impossible, attention is given to the joints not being used or to those that have limited use. Objectives: improve or maintain client's muscle strength, to prevent muscle atrophy and contractures, and to allow patient to maintain joint mobility. Then safety and security measure: wear PPE or gloves if necessary, ensure patient's comfort and safety at all times, inspect and palpate joints for redness, tenderness, pain, swelling, or deformities. The procedure preparation: wash hands, introduce yourself to the client and identify client's identity, explain what you are going to do, why it's necessary, and how the client can cooperate, gather all necessary equipment, and provide privacy. So equipments: no special equipments or supplies are necessary to perform ROM exercises. If appropriate, then sterile gloves or other PPE should be worn. So assuming human na ka nag-wash akong hands, so I'm going to introduce myself to the client. So mayong hapon ma'am, ako din yung student nurse karon, ako sa SGNA Alturas, from Bukidnon State University College of Nursing. So ang procedure nga akong mga sa imo karon ma'am is i-exercise nato yung mga joints or atong i-move para maliyok-liyok pod sila and para dili ra pod ka ma-stiff. Pwede na ko may bawa yung name, ma'am. Pwede thank you, ma'am. And provide privacy. Ay, wala kay kailangan, ma'am. Okay lang ka diha o na-complain. Okay, ma'am. Then step 1, before performing the procedure to the client, ensure that the procedure is not contraindicated. Reviewing the order and plan of care validates the correct patient and correct procedure. So identification of limitations, prevent injuries. So assuming na nag-check na ko sa chart, tagtanaw ang doctors or physician's order sa na ang procedure is wala mga content not contraindicated. So okay naman. So next is step 2, place client in supine position. So rationale is to provide client's comfort. So nakasupine naman ang patient. Nakahiga naman siya, so okay na. Then step 3, elevate the bed at a comfortable working position. Proper bed height help reduce back strain while performing the procedure. So assuming na na-elevate ng bed to my proper working height level, which is the waistline or waist level. Then take initial vital sign and repeat in between procedures. So to monitor client's condition while performing exercise. So assuming na himulan ako ang mga vital sign na kailangan himuon sa patient before doing the procedure. So nahimuon ako tanan. So step 5 na ta. Ang una na himuon sa exercise is sa neck part. So state sa nako tanan kailangan sa neck before na ko i-perform ang procedure. So flexion, position the head as if looking at the toes. Extension, position the head as if looking straight ahead. Then hyperextension, position the head as if looking up the ceiling. Then lateral flexion, patient move head towards one shoulder and then to the other. Then lateral rotation, patient moves the head in twisting motion from side to side. Rationale is to help loosen your posterior neck muscles and reduce tightness. So ma'am, malimot ako nung i-exercise. Next, nakauna magtanong ako sa inyong toes, then back sa atin. 1, 2, 3, go. Back, then ako again, back. Hindi na itatanong ng hands, masin nyo. Back. Dito naman ang website. Mapis na rin yung head, ma'am. Dito naman ang then shoulders, flexion, raise arm forward and overhead, then extension, return arm to the side of the body, then vertical abduction, swing arm out and up, then vertical adduction, move arm downward to the body, then internal rotation, swing the arm up and across the body. Then external rotation, rotate the arm and back, keeping the elbow at the right angle. Rational, performing the shoulder-specific exercise help build strength and mobility in your shoulder muscle and joints. So, Then sa elbow, these movements can be performed in conjunction with the shoulder. So, flexion, cupping the elbow in the hand, then bend the arm, then extension straighten the arm, then rationalize to improve the range of motion in people with chronic conditions like elbow arthritis and etc. So, ating ano yung then wrist, flexion, grasping the palm with one hand and supporting the elbow with other hand. Bend the wrist forward, then extension, straighten the wrist. Then radial deviation, bend the wrist toward the thumb. Then ulnar deviation, bend the wrist toward the little finger. Then circumduction, move the wrist in circular motion to improve the flexibility of the wrist joints. So, dito sa and then back, then sa other side, back, then fingers and thumb. Flexion, bend the fingers and thumb into the palm, then extension, return them to their original position. Then abduction, spread the fingers. Then adduction, return the fingers to the closed position. Then circumduction, move the thumb in circular motion. Then opposition, touch the end of the thumb to each of the fingers in turn. Then move your wrist and fingers to their normal ranges of motion and require all the hand tendons to perform their specific functions. So, dito sa again, and back. Then hip and knee. Flexion, lift the leg, then bending the knee as far as possible towards the patient's head. Then extension, return the leg to the surface of the bed and straighten. Then abduction, move leg outward to the edge of the bed. Adduction, bring leg back to the midline. Then internal rotation, roll entire leg inward. Then external rotation, roll entire leg outward. Then these exercises keep the posterior pelvic muscles in balance. Then the ankle or step 11, the ankle, dorsiflexion, cup heel using forearm, bend ankle towards upper body, then plantar flexion, cup heel and push ankle downward to point toes. Then circumduction, rotate the foot in the ankle, moving it first in one direction, And then, in the other, it will not only help the feet feel better, but may also help other issues in the body. So, din sa tulong ha. Hindi mo. Anak. Yan, so ito yung motion. So, ito yung motion. Then toes, flexion, bend toes downward, extension, bend toes up, in order to move body weight forward. So, ganito. Toes, toes naman tayo. Then next, step 13, the spine extension, stand straight. Then flexion, bend forward from the waist. Then hyperextension, bend backward from the waist. Then lateral flexion, bend toward the side. First left, then right. Then rotation, twist from the waist to the side. First, then right. Then it helps to allow normal spinal movement and desensitize the nervous system. So, nitindog ka mo kaya ng nitindog na sa office. Kaya na yung matindog, ma'am. Wala ka kanalipong, ma'am. Magkira sa pagtindog ay paglikod na sa matindog na, ma'am. Makaya na yung dan dito, ma'am, talikod. Side, dili taon sa left. Sumpa ko pa. Ikas. Then makatwist yung waist. Sige ko. Dili taon sa left, yung taon na. Then, step 14, wash hands to prevent spread of microorganisms. So, na-assume na humaya ko wash of hands, pati ang patient na wash na po na akong hands. Then, keep patient in comfortable position to provide comfort for the patient. So, hindi ko kabalik, ma'am. Then, document in the patient chart to provide client with quality care and ongoing data collection. So, assume mo na document na akong procedure doon, mga complaint ng patient, wala mang pod, so okay naman sa iya. So, that's all. Thank you.